Here are the top 7 biggest mistakes that absolutely make hip arthritis worse. The first one is not addressing the root muscle imbalance. Most healthcare out there is focused on treating hip arthritis with medications, injections, and surgery, but none of these things treat the root muscle imbalance that causes hip arthritis. That means you're just getting short-term relief from hip arthritis. And when it comes to surgery, a lot of people look at that as the last resort, as the solution or the fix for osteoarthritis. And yeah, it does get rid of the joint surfaces that are become arthritic. And so people do have the experience where they have the surgery and it's gone, the pain is gone, but the imbalance that created the bad forces going through the hip joints are still there after surgery. And oftentimes it gets worse because of the incisions and all the procedure that you went through. It leaves people in a weakened state afterwards, and it can set people up to have other problems after the surgery because of that root problem. When I'm talking about a muscle imbalance, what I mean is that if this is the hip joint here, this is the left side of the hip, muscles usually on the front of the hip are much stronger, much shorter, and they're working more often than the muscles on the back of the hip. And it should be a balance between the two, because at the ball and socket of the hip joint, if the muscles on the front side are too strong, then it's going to shift the ball forward in the socket and change the mechanics. And this change in mechanics, slowly over time, over years and even decades, that bad force going through the hip joints is what causes the hip arthritis to slowly progress. There is a process to go through to fix this problem. I'll tell you more about it at the end of this video. Number 2 is leg lift exercises. This is one of the worst things that people can do if you've got hip arthritis. And sadly, this is something that's often recommended by healthcare professionals when treating somebody with hip arthritis. And the leg lift exercises that I'm talking about look like this. There's 4 different ways that are commonly done. The most common one is just picking up your leg from lying down just like this. When you do this, you're using muscles on the front of your hip that are usually too strong already, and you just make them even stronger, which feeds into the muscle imbalance. The other exercise is this one right here, where you're picking up your leg sideways, and you're supposed to be using your hip abductors, the muscles on the outside right here, but between the muscles that are more on the front of the side of the hip and the back and the side of the hip, people get confused on which muscles to use. And if you end up using this muscle right where your front pocket is, it's called the tensor fascia lata, and even the quad muscles on this exercise, then it's going to make the problem worse in your hip joint. It's going to add compression in a bad way to the hip joint. The other 2 versions are this one, where there's different ways that people set it up, but usually you're set up like this and you're picking up your leg this way, or sometimes they'll cross the leg over this way, and you're working out your adductors, the inner thigh muscles right here. Those muscles tend to be over dominant along with the quads. They'll add compression to the hip joint. And then the final one, the 4th one, is hip extension, which is actually good because usually the glutes are weak in this muscle imbalance. And so they'll be lifting up the leg this way. The problem that I find with this exercise when it's done in treatment is that people often compensate with their hamstrings and their back muscles. So they'll arch their back quite a bit and miss using the glutes, ending up using these back muscles and possibly also the hamstring muscles. And both of those muscles, the back and the hamstring muscles, are part of the muscle imbalance that can cause bad forces to go through the hip joint. So these exercises I really never recommend to my hip arthritis patients because they're not productive. There's much better exercises to be doing instead of these. The number 3 worst thing to do if you have hip arthritis is walking. And you're probably stunned to hear me say that because everybody out there will say, walk if you have hip arthritis. What I'm concerned about is if you're walking through pain, like if your hip is hurting, you're forcing yourself to walk, that is not a good thing. That is your hip telling you, I am being irritated more. And the more you walk, the more you're going to irritate me, which moves you farther along in the hip arthritis process. And then maybe you don't have pain while you're walking, but if you're not using the right muscles because you have an untreated muscle imbalance, then there's a great chance that when you do walk, even though it doesn't hurt, you're using the wrong muscles. You're compensating, and you're not walking with a proper walking pattern that forces you to use the right muscles, which means you're going to be training the muscles that feed into the muscle imbalance. So I don't let my patients go on dedicated walks for exercise until we have established that they've created a good balance in the muscles around their hip joints then we can confidently go into walking. But if you're out there walking and you haven't really thought about a muscle imbalance, nobody's ever talked to you about a muscle imbalance, you haven't specifically trained your body to fix a muscle imbalance, then I think walking is probably not a good thing for you. And if it doesn't already hurt, it might hurt you worse down the road. And number 4 is not using a cane or some sort of assistive device to offload your hip joint. And what I'm talking about is just a cane like this. There's all different kinds. I like this one because it has this wider base. This is the Hurricane. I've got a link to it down in the description below if you want to check it out. You can get these at any Walmart, Walgreens, pretty much any pharmacy place or place that has a pharmacy in it with a first aid section. They'll have some version of a cane. I like this a lot if you have hip arthritis, because what's often happening is it's a weight-bearing joint, your hip joint. And if you don't take pressure off the joint and you're still walking on it, then you're going to be irritating it further and further. And you have to walk. You have to move around in the house to take care of your daily activities, take care of your body, feed yourself, bathroom, shower. All those things are basic necessities that you need your hip joint for. And if you're irritating it with each step that you take, then you're going to be making your hip joint worse in the long term. But if you can offload those steps with a cane or something like this, then it's possible that you can get around without further irritating your hip joint, so that you can allow it to calm down and put it into a position where then you can do exercises that are going to benefit your hip for the long term. But I see too many healthcare professionals out there that don't have people use the cane, and then they get a little callous by that, because they'll recommend it at the beginning because everybody in school gets taught you should be using a cane to offload painful hip joints. But we have people that get a social stigma about using this. They feel like it makes them look old. They don't want to be carrying around a cane. Whatever the excuse is, they start to not recommend it anymore because people aren't excited about using a cane. But here in my clinic, I tell people it is vital. If you don't use a cane, you're not going to improve, and we can't get to the next steps that are going to give you the long-lasting relief. You need to make sure that you're offloading properly so that you can get your hip to calm down and put it in a position to do good stuff. The number 5 worst thing to do for hip arthritis is quadricep muscle exercises. These are the muscles in the front of your thigh. Now there's one in particular, this one right here, that runs right in the front of the thigh. It connects to the kneecap, crosses the hip joints. It's called the rectus femoris muscle. That muscle can put a lot of compression on the front side of the hip joint. It can pull the ball forward on the socket and make it rub inappropriately. This is one of the most common sources of the muscle imbalance that I'm talking about that feeds into hip osteoarthritis. If that muscle is compensating, it's being used too much, and if it's already very strong, then it makes sense to not exercise it more, and in fact work out muscles that are going to allow it to relax. Usually the glute muscles on the backside of the hip are a common muscle group that can help that muscle relax. But what often happens is, because these muscles are on the front of your thigh, and if you look down at your legs, it's the first thing that you see, it's very easy to go to the gym and exercising them, and people get a lot of feedback that they're doing something good because they'll get their quad muscles to exercise. There's machines specifically built for this, leg extension machines in the gym, where people can feel the pump or the burn, the blood rushing to the muscle, and get that feedback that they exercised. And even healthcare professionals will exhaustively exercise all the muscles around the hip without paying attention to the imbalances that are present. But if you're out there exercising your quad muscles, then chances are you're going to be feeding into your hip arthritis problem. Number 6 is only stretching in order to help your hip arthritis problem. And I see people do this every now and then, where they'll come in, obviously they're seeing me because stretching hasn't worked, but they'll tell me, I got really into stretching and I had a lot of benefit from it. I started a routine where I was doing 20, 30, 60 minutes of stretching every day, and my hip joint felt so much better. I had relief. But then it started to stiffen up, and I have to keep that routine up. And I have some people that get so far into this that they'll even go to classes, or they'll pick up yoga in order to get more flexibility out of their hip joints. And the thinking at the superficial level makes sense, right? If you have some stiffness in your hip, then go stretch it out. And then if the feedback you're getting is I stretch out and I feel more mobile, then it makes sense. But what's missing is that concept of the muscle imbalance. And in order to fix a muscle imbalance, which puts the joint in the most congruent position for the motion to happen properly at that hip joint where the arthritis is, then you have to strengthen weak muscles. And stretching doesn't really strengthen much. So stretching is really just a short-term solution. I'm not saying it's a bad thing. It's fine if you want to do it. I have patients that come in and tell me they love their yoga class, and I tell them, continue, please. Just don't ignore the strengthening side of it. You need to make sure that you put effort and energy into that, probably more than stretching, in fact, because that's where the long-term relief is going to be. You're going to get much more benefit out of strengthening in the long term, but stretching is going to give you that short-term benefit. Speaking of strengthening, that is number 7 here. People often avoid strengthening. Even healthcare professionals don't put their patients that have hip arthritis through enough strengthening. Now, you'll see people do strengthening exercises against body weight, like those leg lifts that I showed you. They'll do standing versions of those. They'll do a bunch of different exercises that do cause muscles to burn, and I would qualify those as strengthening exercises, but what I'm talking about is weightlifting exercises. Now, don't jump into those, taking my advice right now thinking, well, he said to do weightlifting exercises and I have hip arthritis and I haven't tried that out. You need to do it at the right time. You need to make sure that you've calmed down the pain in your hip, that you've already addressed the muscle imbalance. And at this point, you should be feeling significantly better in your hip arthritis. And then at that point, you should be ready to begin to introduce weights. And I always start with tiny weights like 1, 2, 3, 5 pounds. And gradually, slowly progress into heavier weights. But I have consistently trained people with hip arthritis, people that have been on canes and limping around, to picking up heavy barbells like the power lifters and the bodybuilders use in the gym, because it is necessary to boost the strength up in those weakest muscles that much to protect your hip joint, to put those muscles in balance, to protect the mechanics and the movement at the hip joint for the long term. But people are afraid to do that because of their age. They're afraid to mess it up. They don't know how to use that equipment and lift the weights properly. Or maybe it's hurt them in the past and they're a little bit traumatized from that. All of those things need to be addressed in order for you to get the longest term relief from an exercise plan to fix hip arthritis. Now, if you're confused, you don't know where to start, I want to let you know that I've got a program designed to help somebody go all the way from severe hip pain to lifting weights successfully, pain-free, and confidently to help their hip. It's called the Hip Arthritis Recovery Program. You can learn all about it. There's a link in the description below. It's a comprehensive plan, over 30 videos of me walking you through every step of what you need to do to resolve your hip arthritis problem naturally and for the long term. Now, I've also got a bunch of videos for free here on YouTube in a playlist called the Hip Arthritis Health Playlist. You'll find a link to that down in the description below as well. Hey, if this video helped you out, please share it with somebody you think needs to see this. Please give us a like, subscribe to our channel if you haven't already, and drop a comment down here. Let us know if this video was helpful for you or if you've been helped by us in the past. Please give us some feedback, ask a question, and we're happy to help you. Thanks so much for watching, and I'll see you in the next video. Bye-bye.